There are a lot of queries about it, so I'm going to solve all your queries, okay? And at the end, if you have any queries, you are more than welcome to talk to me also, and you can send your question in chat box. I'll be very happy to reply to all the questions, okay? Well, first of all, there's a lot of confusion among students. Confusion lies in the thing that we should do Indian PG or PLAB or MLE or MRCP. And same thing for those who are outside India, they again have a lot of confusion whether we should go for local MD or anything else. So don't worry, I'll be answering all the questions. First of all, what is MRCP? Is a postgraduate degree of UK which is equivalent to MD or DNB degree of India. This is very important. Why it's so important? Many of you want to do MD medicine or DNB medicine in India. We don't get. Then you have another option. It is recognized by National Medical Council, what we call as NMC now, and previously it was Medical Council of India. So this again, you need an authenticity that whether that is recognized or not. It's a very, very important point. That means when you come back from UK and when you want to practice in India, yes, it is a recognized degree recognized by NMC. And this the government notification, it is there. You can very well check in the government site also, okay. What it also write that anybody who get any degree regarding getting from USA, UK, Canada, Australia, New Zealand, and they desire to work as in a medical college, you can even join in the medical college also as a faculty. So not only you can join government job, you can very well join any government medical college also, and of course in the private practice, in the corporate hospital, you are more than welcome. Okay. Well, the next point, it is much more valuable. What do you mean by this? If I give you 100 rupee note, $100 or 100 pounds, then definitely you like to take 100 pounds because this is 100 times more valuable than 100 rupees. This is 75 times more valuable than 100 rupees. So definitely this is much more valuable internationally also. So it has a lot of commercial value also. Now, did you know that there are certain points that you should know? Part 1, Part 2, they are online exams. You need not go to UK. Very, very important point. This is a common myth that you have to go to UK. No, you can very well write in your country, wherever you are in the world. In all the big cities that they have centers that you can check in the website. Okay, you can do MRCP soon after completing your internship. Again, a big point. Most of people are not aware, but completing internship is mandatory. Now, if you go to website of MRCP, what they write, you need 1 year. 1 year of post-graduation experience. This is a very confusing line. Now let me clarify. I really did a lot of groundwork in what the meaning. What we think that they want at least one year of MD is required. No, no. Suppose you pass your MBBS exam today, whatever country you are, you pass, your result got declared, and you do internship. And you do internship for 12 months. And this 12 month is known as postgraduate experience. So in nutshell, 1 year of postgraduate experience means they want your internship should be there. Internship should be completed in whichever college you are in the world, provided your college is recognized by the World Medical Council. That is very essential. Okay, so now you are clear about it. So soon after doing your internship, completing your internship, you can write this exam. No entrance exam. I think this is the biggest advantage. There's no competition exam. Most of the time, especially in Indian exam, we have a competitive exam. I'll talk more about this. So it's not a competitive exam. Competitive exam is game of musical chair. All of us have played this game of musical chair. There's only one chair, and there are so many people who are competing for this chair, and that's a problem in our country. Now, each one of them is like Indian exam are written by about 2 lakhs people, they write the exam. 1.5 to 2 lakhs, somewhere this figure is there, who compete. Now you want to get MD medicine in a good college, maybe Delhi College or Bombay College or Chennai College, big prestigious colleges. You have to be among the first 1, 2 or 3,000. Otherwise you will not get a seat. Okay, like suppose somebody gets a seat rank of 5,000 out of 2 lakhs people. 2 lakhs for those who are outside India is 200,000. Okay, 200,000 is the 2 lakhs. Out of 200,000, you have to be, even in the 5,000 seat you got it, you will not get MD medicine in a good college. Are you not intelligent? Yes, you are very intelligent, but still you are not getting a seat. That's the biggest drawback of any competitive exam. So what I always say is that Indian PG exam are game of musical chair. 100 people play a game, only one seat is there. And remember, those who do not get seat doesn't mean that they are not capable or they are not intelligent, but number of seats are less. So in contrast, MRCP is a passing exam. That means in musical chair, you have to beat others to get a seat. But here you have to beat yourself. You have to work hard. They are not easy exam. Don't think they are very easy exam. You have to work hard. Of course, you want to get a good rank in NEET PG, Indian PG also, you have to work hard. But there is no competition. You are not under great stress. Oh, my rank is not good. It's not like that. Biggest advantage. Well, look into this. This is the scenario of Indian PG exam. These number of seats are there, 1, 2, 3, 4, 5. And unfortunately, good amount of seats are reserved not for you. Now only one seat is there. Now there are 100 brilliant students are there like you. 100 students are there. So you have to beat others to get a seat. You have to beat 99 other people to get a seat. So it's a very tough competition. Okay. And now in MRCP or PLAB also, there are, and one more thing, there are 100 people who write Indian PG exam. In contrast, MRCP is written by only few people, not everybody write. Why? People are not aware of this exam. Now, there are 5 brilliant students and there are 5 seats, so you have to beat yourself to get a seat. So it's not a, in that regard, it's no competition. This for PLAB and MRCP. So these 2 slides are good enough. Less people write and there are more people and less number of seats are there, right? So I hope you understood the meaning, but they have a good standard of exam that nobody can deny it. Held 4 times a year, again advantage. Unlike Indian PG, which happen only once a year, you miss a train once, that means you have to wait for 1 more year, and in 1 more year things change. In unfortunate situation, if somebody doesn't get for 2 years, then things change drastically. Here it's 4 times a year. And you can write your exam in your own city or country or all major cities. Suppose you are in a small city, but in all major cities in the world, centers are there that you can check it. That means you don't have to go out of your country. Okay? Especially in India, there are large number of centers are there. Now, one more thing, even if you are already doing MD in any other subject, suppose you are doing MD Pharma. In your days when you competed for the exam, you wanted MD medicine, but unfortunately you did not get it and you settled down for Pharma. But you have a great love for medicine. You want MD medicine. You carry on doing MD Pharma. You can write MRCP exam. Same time, you prepare for MRCP without leaving your job. without leaving your current profession or whatever you are doing, okay, you can write MD MRCP. You get postgraduate degree of your own dream branch, internal medicine. That is a MRCP. So you are MD Pharma as well as MRCP. Your dream branch is there with you. So without leaving your course or job, you can do MRCP. Biggest advantage. Okay. Thesis not required. We all know there's a big headache for MD people, especially in Indian postgraduate. Research paper are not required, non-mandatory that you should have some research paper. You can very well write these exams without any research paper. They're not expensive also. Why? Because many people, they go for USMLE. USMLE costs around 40 lakhs rupees. If I have to write in figures, this much rupees are needed for USMLE once you enter USA. I'll talk more about this in the coming slide. But in contrast, all these are done in your own country. We don't have to spend any amount of money unless except the examination fees. Okay, examination fees for step 1 and step 2 is around rupees, somewhere around 70,000. That comes out to be almost in the range of equivalent to 700 pounds. Same thing for step 2 also. Step 3 is little more expensive. That means, and of course, MLE fees is even, examination fees is even more than MRCP examination fees. Okay, but definitely not as expensive as USMLE. Well, once you have done your MRCP, you can very well do super specialty in any branch in UK without any entrance exam. The biggest hurdle in India, even if you get MD medicine, you got in a very prestigious college, but again for DM, so you have a hurdle, MBBS hurdle is, bottleneck is there for getting into MD. You go into MD medicine. Again for DM, you have a one more bottleneck is there for this for DM. So you have bottlenecks are there. These bottlenecks are not there in MRCP passing exam. Okay. Recognized by NMC, I told you, so previously it was MCI, now NMC, but still many people do, by tradition they call MCI, but well, NMC is the new word. You can join any government job, medical college in India and UK also, depending on at least you can very well join in India. Regarding UK also, you get a chance. They all depend on the local situation. But India, it is very much recognized. Okay, and you can become a member of API, Association of Physicians in India. You can become, because it's a recognized degree. And this degree is, this association, to join this association, postgraduate degree is mandatory. So you can join it. Salary in India after MD is in the range of 7 to 8 lakh rupees. But after MRCP, okay, so you can say this is the salary that you get in after MD, but in after MRCP 10 times, you get 70,000 or 82,000 pounds. This is 7,000, 70,000, 10 times salary you are getting after, when you are doing MRCP, when you go to UK. Okay. And one more thing, after MD medicine, you go to Gulf country. Maybe you get salary of 100 rupees, just for theory says. But after MRCP, the salary is much more than what you're getting. So even in the Gulf country and other countries, MRCP has much more value as compared to MD medicine. So now you can see. And there's no bond of work. This again a new problem which is being created for our medical doctors. Oh, government say you have done MD or you are doing MD. You can't leave for bond of so many years, so many lakh rupees, etc. This is a big hurdle. One more artificially created bottleneck is there. All these are not in UK. Bond, I hope all of you will be agreeing, is a big headache. They're asking if you leave, even if you leave it, you get a seat of MD, you leave it, you have to pay this much amount, blah, blah. All these are nothing. So what I always say, you carry on doing your MD, simultaneously you prepare for MRCP. and you can fly to UK. Well, one a very commonly asked question for those who are studying outside India, what we call them foreign graduates. Okay, many of you are in country like China, Russia, Ukraine, Philippines, Malaysia, or Bulgaria, etc., or in so-called Caribbean countries. After that, you want to come to India, you have to clear FMG exam. Yes, is again a tough exam, is a rather okay, but if your college is recognized by World Medical Council, okay, you do your internship in your college and you can very well write MRCP. So you no need to come to India. You can straight away fly to UK after passing MRCP. So I have removed the bottleneck of FMG exam also. But repeating second time, internship is mandatory. Without doing 12 months internship, you cannot write MRCP exam. So do in your native country and write MRCP, fly to UK. And one more, once you have done MRCP, you come back to India, it is recognized by NMC. So now that bottleneck of FMG is removed. If you have MRCP, it is recognized degree. Standard of work and culture, salary difference between Maruti car and the Rolls-Royce, huge differences there. The work culture, what they have, cannot be seen in subcontinent countries. I don't need to elaborate. You will have it altogether different. Your approach will be different. Your thought process will be different. You will be altogether a different person. Okay. Now, this was lot of information about MRCP. Now, what is PLAB? Is an exam to enter and work in UK. You are MBBS, you pass, you go to UK, you get a license to work. But you remain, it's not a degree. Not degree, it's a work permit. You can very well join job there. Okay, you can go work, you get salary also. Very handsome salary, you get it. And it is a very easy exam. Very easy exam. It's a mini version of MRCP Part 1. That means you do our MRCP Part 1, PLAB will be very easy for you to clear. Okay, once you clear the PLAB, you are in UK. You are in UK, PLAB, and you can continue studying MRCP and you clear MRCP there also. Or you can continue, you join our MRCP course, you write it and go there. Now, do you need to clear PLAB? No, you don't need to clear PLAB to write MRCP. No. You want to do PLAB, you can do it, but it's not necessary. So, no necessary to join to do PLAB. You can straight away write MRCP and you are a specialist. I told you, MRCP is a degree which you can get it after clearing the exam. So, it means if you join our MRCP Part 1 course and you clear your PLAB exam very easily and then you can go to UK, get a job and you continue studying MRCP and clear MRCP. About this, I'm going to show you in the next slides. So you continue your MRCP Part 1 preparation once you have cleared the PLAB exam and you get a salary about 35,000 to 40,000 pounds per annum is the salary after clearing PLAB. But after MRCP, the salary is almost double of this much amount. So now look into this. This is the high jump. This is the PLAB. You can see PLAB level. This is MRCP, NEET level. Oh, we never knew. So difficulty of NEET is much more than MRCP. I repeat again, NEET is much more difficult because you have to read 19 subjects that you can read. Problem is competition. You have to beat others. Beat others. Okay. Well, you talk to any sports person, he will say, you should play that game which you play yourself. They always say join badminton, tennis, because you are not in a team. You can play tennis, badminton for 20 years. But if you have to join a team like football, hockey, cricket, anybody can replace you. You don't play 2 games, 2 matches, don't play good, you are out. So always play those games which you are independent, where you can take a rest, you can join whatever you want. Exactly same thing. The PLAB and MRCP are like independent game like tennis or like badminton, etc. or athletics. But NEET is like a game, cricket, football, hockey. And I told you difficulty level, NEET is more than MRCP. And value, but a value is much more than MRCP, has much more value than MD. This slide is a self-explanatory about difficulty and value. Okay, and I told you PLAB is a mini version of MRCP, just very easy to jump, very easy. Even a average or below average student, so-called, they're nothing like below average, nothing like average. All of you are extraordinarily intelligent. Many people say, oh, parent will come, oh, my child is average. I say, don't say like this thing. Your child is champion. Champions are not born, they are made by proper training. Right? So don't get disheartened. If you don't get success in NEET exam, don't get disheartened at all. You are the best. We will make you the best in the world. But look into this. I'm advising you for easier exam to clear. Now I'll discuss certain cases. Well, the case number 1. The case number 1 says, sir, I appeared for NEET exam this year, 2021. And result is out recently. And I got very good mark and I will join MD or DNB medicine. What is your advice? For those who got good rank and they are sure they are going to get MD or DNB medicine. So my is, you also join our MRCP Part 1 course. And the following will be the outcome. Your counseling and joining of MD will take at least 3 to 4 months, definitely. Okay, today is you can say today is 16th October 2021. It will take 2, 3, 4 months before all these administrative formalities are completed. And these 3, 4 months are good enough. If you study very hard, you can finish the whole syllabus of MRCP Part 1. And of course, this is also syllabus for MD medicine also. Remember, MRCP syllabus is altogether a clinical base which include almost whole course of MD medicine also, right? Provided if you really utilize this time properly, utilize these 3, 4 months, you study hard the way you have studied before the exam, and you utilize the time properly, you will be able to finish the course in the next couple of months. Now, when you are doing MD or DNB medicine as you got it, you continue study of MRCP course. And this will help you great in your MD exam also, preparation. And you will be able to clear your MRCP before your MD exam. If you join my course today, your MD will be after 3 years. Let's presume that you are joining MD medicine in Jan 2022. Okay, so you will be able to clear only in 2025. Before that, you will be able to clear your MRCP exam. And that means by the time you clear your MD as well as MRCP. Your name will be MD Medicine, MRCP also. Okay. And after MD, you have to compete for DM entrance, as I told you. Again, competition. Is there any guarantee that after MD you will get DM in first go? Nobody can say. Nobody can say 100% in India. Or you can go to now. Remember, you have MD, you have MRCP. If you have MRCP, go to UK for super specialty without entrance exam. No competition. Again, advantage. You will be very relaxed in MD because you already have MRCP. You know, I can very well do a super specialty in UK, which is much more valuable. In UK, you get a salary of 70 to 80,000 pounds. That means if we talk about Indian figures, 70 to 80 lakhs of rupees per annum is the salary, which we don't get in India or any of the subcontinent countries. If you want, you continue working there, or you come back to India and join as a senior consultant in big hospital like Apollo, Fortis, Medanta. Usually, now after MD, or DM also, you will be working as a senior resident, SR, also called registrar. But after super specialty of UK, you come to India and join as a consultant. That means your batchmate will be working under you. They will be working as a senior resident and you are the senior consultant. Difference will lie in resident and consultant. Same apply for those who are currently doing MD, DNB, internal medicine or respiratory medicine or family medicine also, or those who are already having done post-graduation in these specialties. Very commonly asked, sir, I did my MD medicine 5 years back or 10 years back. Can I write MRCP? Yes. I am doing MD in internal medicine or respiratory medicine or in family medicine or other specialty, any specialty. Okay, you have done MD Pharma or doing MD Pharma, you can write. Even MD Patho, any degree, only thing, anything is your internship should be completed. Everybody can write the exam. If you have a dream, we will make it dream come true. This will guide you. Let's take case number 2. I appeared for NEET exam this year, but I could not get good marks. But I want to do MD medicine. This is my dream branch. It's my dream branch. What should I do? Remember, in the previous case, he already got good marks. But now the student wants to do MD medicine desperately, but did not get good marks. So what should you do? You continue preparing for coming NEET exam, which will be most likely held in April 2022, most likely. You join our MRCP Part 1 course and following will be the outcome. Okay. Plan A, you write your NEET exam in April. If you get MD, DNB medicine, you join it in India and you continue reading content of MRCP Part 1 course. They will help you in preparing your MD exam preparation. The way I told you, case number 1, you will be able to clear your MRCP before your MD, the way I told you in case number 1. Super specialty you can do as I discussed. Okay, because this MRCP Part 1 will be giving you great help in your NEET preparation also. Why and how I'll be discussing soon. If due to any reason you could not get dream branch, nobody can be sure in any competitive exam. I know you are very intelligent, you are very hardworking, but still, unfortunately, you could not get. You continue, you go for plan B and plan C. What is plan B? Plan C. Plan B, you carry on studying. Remember, this for those, unfortunately, they could not clear MD, they could not get MD medicine in 2022. Then you continue our MRCP Part 1 course which you are studying. You clear your PLAB exam. Very easily in the month of April, May only you can get. That means you are studying our MRCP Part 1 course. This is a NEET exam. MD medicine. MD medicine. You get it, go ahead. If not, then you go this side. This is PLAB. Very easily you will clear it. Okay, PLAB, clear it and you continue working for MRCP. Or in this, you don't go PLAB. You are not getting seat for NEET. You don't want to go to, you want to PLAB. You continue with MRCP. MRCP you can do after going to UK also, or you continue doing in India. And once you in India, you can very well pass your MRCP and go to UK. So in April 2022, NEET, PLAB or MRCP, you will have 3 directions to move. And finally, you land up in UK, go for super specialty. Okay. And you go to UK and join a job after passing PLAB and you start getting salary of 35 to 40,000 pounds, 30 to 40 lakh. This is what I discussed about PLAB. I'm talking. PLAB is the way to get a job in UK. And as I told you, you continue preparing online preparation of MRCP and clear your MRCP exam. Plan C. This is the plan B. This was the plan B. This is plan C. C plan. You continue staying in India, prepare for MRCP and fly to UK is plan C. So plan A, plan B and plan C. 3 directions are there in April 2022. As I told you, you stay in India, do MRCP part 1 and this exam is held 4 times a year. The detail I discussed, this come in plan C. And super specially directly, no entrance exam as I inform you. Case number 3, I have graduated from outside India, China, Russia, Philippines, Ukraine, etc. And I could not clear FMG exam. What should I do? Could not clear FMG. That I told you, with join our MRCP course, you can clear PLAB exam, very easy exam. Okay, you can go to UK if you have provided you have done internship. One thing is very clear. One thing is very clear. Even you are a FMG, you have done you have cleared FMG exam in India, but you are not able to get seat in MD. Don't worry. Write PLAB. Fly to UK. Very easy exam, and your life will change. Okay, life will change and you will be super specialist with a much more valuable. Okay, but again, repeating second time, internship is mandatory. If internship not done, then this MRCP course will help you. Provided, remember, internship is mandatory. Okay, and even suppose you are not done internship and you want to prepare for exam, FMG exam, it will help you in clearing your FMG exam also. So this knowledge will clear your FMG exam also, it will clear your NEET PG exam also. And I told you, once you pass FMG, you can write NEET or PLAB or MRCP. You can go for NEET, plan A, plan B or plan C. Again, golden opportunity to work. Now, important point, we have launched online MRCP part 1 course. Now, let us read more about MRCP. How many steps are there? Step part 1, part 2 and part 3. MRCP part 3 is a basis, what we call it, it's a practical exam. Now, what we are offering you? We are offering you at the moment MRCP part 1, but soon we'll be launching MRCP part 2 in a couple of months. By the time you clear your MRCP part 1, we'll be able to do MRCP part 2 also. We are working on arranging PACES training program in India, so that we'll be helping you in part 3 also. Part 3, this we are trying to arrange. By the time you clear your MRCP part 2, we will have arrangement for the PACES training in India also. Now, what is strategy? Well, I told you we have launched MRCP part 1. What is strategy? We have a 3-stage strategy to pass MRCP part 1 in flying colors. Let me discuss. First step is basic concept. Second is test and discussion, and third is mock test with explanatory answers. What are these? This I am going to discuss in detail one by one. First step, you should know your basic concept very well. That is a prerequisite for foreign exam like MRCP and USMLE. They do not ask a subject. They don't ask anatomy, physiology, biochemistry. They ask concepts. Okay, for example, look into this. I have a case for you. Well, you can read this. I give you 60 seconds to read and answer the question. This is a typical sample. They ask a clinical based question. They want you should know in and out. In one question only, you are supposed to know anatomy, physiology, biochemistry, patho. This example. Okay, even if you do wrong, don't worry. The answer is autosomal recessive is there. Only I marked the answer because time shortage is there. I'm not teaching you. I'm just telling you what type of question they ask. This is about Wilson disease. The point is, he asked a clinical scenario and ultimately he asked what the inheritance. Okay. So, unless you know the basic concept, you cannot solve the question. Very important. Because they don't talk subject, they talk concept. They don't ask a subject, they ask a topic. You should be fully aware everything about every topic. There's nothing like important. Now, a common senior says, do past test, past method, the usual question, bank. You will clear. No, it's the most common mistake. Same mistake for MLE also, you do question bank of U world, blah, blah. No way. Unless you know the basic concept, there's no point in doing the question bank. Because there's no one. Why the senior says, because there's no one to teach them. We have basic concept. In their time, basic concept were not there. They were totally dependent on past test, past med. But we are there to guide you to teach the basic concept. Okay. So senior says, many students do talk to me. My senior says, then I say, I am senior to your seniors also. Got it? So basic concept should be very, very clear. Doing question without knowing the basic is the biggest mistake of student and the main cause of failure in the exam. So don't commit the mistake. It is good to know how to get success, but better to know how not to fail. Don't do the blunder mistake of just jumping into question bank. And what to do, when to do, this I'll be talking to you in due course of time. Solution to the problem is that we have 350 hours of pre-recorded lectures of whole MRCP Part 1 syllabus. You can adjust the speed of the video for faster view, 1.5, 1.7, 2 point. You can increase the speed also depending on what is your speed of reading. It will clear your basic concept. Okay. Having strong basic concept is the most essential requirement to pass PLAB and MRCP. Reminder, PLAB is a mini version of MRCP which is much easier to pass. They ask topic, not a subject, the point of what I've been emphasizing again and again. Second step, once you have done the whole syllabus, then we'll give you topic-wise tests and discussion. Like you have done diabetes, you'll get question on diabetes. The question will be based from the past test, past med and BMG on examination. Like that question only will give you, you do the test. You submit the paper, you get the answer key, then we will discuss also why the option A is correct, other are not correct. So test and discussion. Oh, I committed this mistake. In that way, we'll cover entire syllabus for you. Now come the third step, mock test with activity answer. This what people do. Past test, past med, they do like this. This step 3. We will give you full syllabus. And still you feel then for practice, then you can go for past test, past med, you can go for practice. And once after doing our step 1, take a stage 1, stage 2. Third, this stage, after doing this thing, after this, if you go for step 4, practice test, you can do past test, past med. Then you find the question are extremely easy. You can answer tuck, 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 that also. And moreover, when we are teaching you, we are giving you LMRP. LMRP is the last minute revision point. Golden line to remember. We'll be giving you a lot of golden line to remember. With this, if you remember this, you can very well, you can revise the entire syllabus 10 times in 3 days before the exam, and nothing will come from outside. And if you do this much, 90% of the question will come from what I have taught you. Nothing as it is, content will be there. In 90%, if you do correct, you are the topper. And remember, about 60% are needed to pass the exam. Of course, they don't declare it, but it is usually 60% question are correct, you clear the MRCP exam. Now, additional advantage of joining our course, we have a doubt clearing platform. Nobody else can give you. You have doubt, you can very well ask the question. We'll solve. We will reply soon. Personalized mentoring we do. Very essential. This everybody needs to guide you. What do you mean? You all have driven bicycle in your childhood. If the pressure in the tire is less, you have to exert more to drive the cycle. But if the tire are full of air, then your driving become easy. Same thing. I'll fill air in your body so that you become much more hardworking. Your style of change, the study will change. You will be much more efficient to be more precise. Like people say, I feel very sleepy and tired while studying. I study a lot, but I tend to forget. There's always cloudiness in my mind. Which book, question bank should I read? All these guidance you need, and I'll be give you an introductory lecture also about all this. How to study efficiently, how to manage time efficiently, how to study with such a heavy duties. All these guidance I'll give to you. Okay, how to utilize the time in the most effective way. Even if you are doing 24-hour duties, I'll guide you how to utilize this time also. If you do this way, you will be clear your MRCP Part 1 exam in flying colors. It is not the speed we determine the destination, but the right direction. The right direction, which is the USP of DBMCI. Unique product in the world. No one else is doing like this. Whole world is a world record. All at one place. Concept, test and discussion, and practice test at one place. Kindle notes are ready. In fact, today was the only day when we completed Kindle notes. We'll be giving free to you. You don't need to read anything. The Kindle notes are about the medicine, but we'll be okay. No other institute is giving these services: lecture, T&D, doubt clearing per platform, personalized mentoring. I have also written the book Mini Medicine Simplified, which is Mini Harrison, but this will be giving in the form of Kindle notes to you. Now, additional thing which we have done today only. We have been working on this project for last. Many people say, sir, it is difficult to write the notes. So don't worry. These are the notes written by student who already joined our course. Okay, and like this, whatever notes exactly written, it is what is you will be watching the video. Notes are written in front of you, so you can add whatever you want. So you save a lot of time. Moreover, when you are watching the video, you can increase the speed to 1.25. Or you can increase the speed to 1.5, 1.7.2. That means you can see the video much faster, and you will be getting these notes so that you can write add on to this. Frequently asked question: when should I start preparing for MRCP? During your undergraduate days, or if you are already intern or post intern or MD, from today. When can I write exams? Soon after completing MBBS and internship. Next NEET exam in April will prepare you for both. Easy to do MRCP for after MD and DNB. It is much easier. Those who are doing MD or DNB medicine or family medicine, respiratory medicine, it's very easy to pass even MRCP also. Now let me give you a comparison. Indian PG MRCP entrance exam, yes, no. Number of time, once a year, 4 times a year. International value, less, much more. Musical chair, yes or no. The point I already discussed. MLE MRCP costs around 55,000 US dollar. No extra cost. Research paper, yes, no. Strong CV, yes, no. Postgraduate degree, no. It is a yes. Tough, more tough, because lots of extra things are needed. And entry to USA is not a postgraduate degree, it's a postgraduate degree equivalent to MD medicine. Indian PG and MLE are like this, and elevator, MRCP PLAB, I think there is self-explanatory about the comfort and the toughness. Well, you can join our Telegram group also, Dr. Bhatia MRCP Part 1 discussion group. We post a lot of questions daily, a lot of questions with the expert answer daily. Friends, I always say you are extraordinarily brilliant. Due to any reason, not everybody gets success, but don't worry. You are like a raw diamond. When the raw diamond come out of the earth, it's just like an ordinary stone. It is to be polished to best the best glow out of that only. You are like that only. We will train you. We will train you to make the best glow out of you, and we will convert a ordinary stone to the precious diamond like you. Like you, we will shape your talent. We'll polish your talent. We'll get the best out of you to go to top level of success. So our aim is to make you like an eagle. Clouds, it flies above the clouds. Rains doesn't disturb eagle. And remember, above the cloud, temperature may be as low as minus 40 degrees. Remember, it can come down to the earth to catch the food, plus 40 degrees. So this bird is adjustable. Remember, its body has been designed in such a way from minus 40 to plus 40 degrees, it can accommodate. Tough. So same thing, we will make you like this. So you can write, you can adjust in any environment, any exam in the world. Basic should be very, very strong. Our aim is to make you like this. Rolls-Royce, the dream car for everyone. This is the way you are. You deserve it. You deserve this car. You'll get by your own hard work. Remember, but there is no shortcut to hard work. Hard work should be done in a smart way. How to do smart work, I will guide you. We will train you. Okay. So if you have any queries, please, you can very well contact on this WhatsApp number. And this is my personal email ID. This is the number of my staff. You can very well ask any question. He will be discussing and will be answering to all your queries. This is my personal email ID. Any queries you want to ask, you can very well ask. We'll be too happy to solve your queries and answer your queries. Okay, so thank you very much. I hope you learned a lot, and I can display this slide for a few more seconds so that you can write down the number. By now you must have written, or you can take a click also. And we are accessible any day, anytime. You can ask me any number of questions. We'll be too happy to reply. So finally, thanks again. But before I close, my staff has given me certain questions. Thank you. Just wait. So there are certain questions which students have asked me. My staff has given in writing. First question, MRCP is PG degree, right? Then if we get MRCP, then if we get a PG in medicine, can we do medicine? And it's no, it is only for MD medicine. After MRCP, you cannot do anesthesia, you cannot do surgery. It is just like you have done MD medicine. You cannot work as an anesthetist. Okay? This question came from Amal Roy. I hope, Amal, you got an answer. Okay. Well, Amal Roy also said that after MRCP, I want to do surgery. Why you want to go for surgery? You already have MD medicine or MRCP. Why you want to go for surgery and anesthesia? Second question, this question came from Ali Sher. Sir, I want to join MRCP program from your deemed coaching center. How many hours per day is required? Very good question. Well, I got videos for you. I got 200 videos for you. Okay. If you can see one video per day, that means 200 days are needed. Now you can calculate. And if you can study double, you can finish in 100 days also. If you see only half video, then you need 400 days. If you see 2 videos, you need 100 days. Very simple mathematics. Okay. And one video is around 2 hours duration. Question 3. Dhaval Upadhyay has asked this question. Sir, can I clear all steps of MRCP in 1 year? Yes, you can if you can work hard. Because these exams are held 4 times a year. And you clear your MRCP part 1. When we will train you for MRCP part 1, half of the part 2 syllabus will cover. So you can clear it in 1 year or 1.5 years, depending on how much input you can do. All depends. I think this figure is self-explanatory. Question from Dr. RK, how to clear PACES? Well, the practical exam. You have to see the patients. And I told you we are trying to arrange a lot of PACES training program in India only. Detail will share with you soon. One question from Dr. Lal, he did not mention about PACE, which is very difficult to clear. Yes, I told you, PACE exam is a practical exam. You have to see the patient and discussion about, because as of now, we are talking about MRCP part 1 mainly, and part 2, their online exam. So I focus more on this PACE practical exam. There are many centers who do practical training also. We are also planning to start soon. Look, there's nothing like difficult. There's nothing like easy. You all have done MBBS. In your school days, you appeared for MBBS entrance, you cleared, and you became doctor or medical student. Many of your colleagues in school, they could not clear MBBS entrance exam. They could not. For them, that exam was difficult. For you, it was easy. Easy and difficult lies in the brain. All depend how much hard work you do. We are there to make your difficult thing into easy. Okay. A question from Doc Pratt 24. What about MRCS? Well, it is a surgical, this for those who want to do surgical postgraduate. We don't do MRCS. MRCS, we don't do. Similarly, for pediatric, we have H. For gynae, we have MRCOG. These we don't do at the moment. Maybe in the future we can think, but not at the moment. Then there is one question from Firdos Fiaz. Do you need internship for PLAB as well as? Yes. Without internship, you cannot do PLAB also. Please, Dr. Shakti, please tell about MRCS that I discussed. We don't do MRCS. Well, this is the question which my staff handed over to me in writing. You still have any question, I already given you WhatsApp number or email ID also. You can very well ask. We are just one WhatsApp or one email ID distance is there. We are very much accessible and we are always help you out in all the possible way. I hope it was a good session. You learned, you may be having a lot of queries, but however, time constraint is there. So we close the session. Thank you very much. God bless all of you. Thank you very much.